Welcome! If you're getting ready for your phlebotomy certification, you've come to the right place. We're going to break down the entire venipuncture process step by step to help you build the confidence and the skills you need to not just pass your exam, but to really shine in your new career. So here's how we'll tackle this. First, we'll lay the groundwork. That's all the super important stuff you do before the needle even makes an appearance. Then we'll walk through the draw itself and cover exactly what to do in those critical moments after. And finally, we'll pull it all together, looking at quality, safety, and how to turn these steps into solid professional habits. Okay, first things first, let's talk about the absolute foundation of every single good draw, the order and the patient ID. You know, if you get this part right, you're setting yourself up for success. But if you get it wrong, well, things can go south before you've even begun. So let me ask you this. Where does a perfect draw really begin? It might seem obvious, but really think about it. Is it the moment you find that perfect vein, or when you uncap the needle? The answer is actually so important for quality control. And here's the answer. It all starts before you even walk into the patient's room. A successful, error-free venipuncture begins the second you get that requisition. A complete, verified order, that's your true starting line. This protocol is your best friend. Seriously. Think of it as a three-way check. You've got what the patient tells you, what's on their wristband, and what's on your order. All three have to match 100%. And look at number 5. If anything doesn't line up, you stop. You don't guess, you don't just go with it, you get it fixed. This process prevents some of the worst errors in healthcare. Okay, heads up, this is a huge point for your certification exam. You will almost certainly get a question about this. If the name is spelled slightly differently or the date of birth is off by a day, the only right answer is to stop the procedure and get that discrepancy resolved. All right, so we've got the right order, and we've positively identified our patient. Our foundation is solid. Now it's time to get everything ready for the draw itself. Picking the right gear and prepping the site properly is half the battle. Think of this as your equipment cheat sheet. For most situations, the evacuated tube system, or ETS, is your go-to. It's the standard. But you've got to know when to call an audible. Got small, tricky veins in the hand? A wing set or a butterfly is going to give you way more control. And if you're worried a vein might collapse, using a syringe lets you control the pressure of the draw manually. Listen up, because this is a massive safety rule that you just can't forget. If you use a syringe, you must use a safety transfer device to fill your tubes. Never, ever, ever poke the syringe needle through the tube stopper. It's a huge needle stick risk, an OSHA violation, and it can actually damage the blood cells, which will completely ruin the sample. Every single one of these steps is here for a reason. You have to keep that tourniquet on for 60 seconds or less to avoid changing the test results. Your number one choice for a vein is always the median cubital. It's big, it doesn't roll much, and it's less painful for your patient. It's just the best spot to aim for. You know, it's so tempting to just rush this step, but don't. That 30 seconds it takes for the alcohol to air dry is so important. If you poke through wet alcohol, it's going to sting the patient, for one. And 2, it can cause hemolysis. That's when red blood cells burst, which will get your sample rejected by the lab. So just be patient, let it dry. And now it's time for the main event, the draw itself. We've got the right patient, the right gear, a perfectly prepped site. So let's talk about technique. Each of these little details really matters. You want to anchor that vein so it doesn't roll away. Go in at a nice shallow angle between 15 and 30 degrees with the bevel facing up. As soon as you see that beautiful blood flow, pop the tourniquet. And then the instant that needle comes out of the arm, you click that safety feature. It has to be a reflex. Okay, this is one of the most important things you need to burn into your memory for the exam. The order of draw. It's designed to prevent additives from one tube from messing up the tests in the next tubes. Sterile cultures always go first, so you don't contaminate them. Light blue for coagulation tests comes next, and so on. A good mnemonic to help you remember is stop, light, red, stay put, green, light, go. All right, here's a classic exam trap, so pay close attention. When you use a butterfly needle, there's a little bit of air in the tubing. If you put that light blue tube on first, the air gets sucked in and the tube won't fill all the way. That messes up the crucial blood to additive ratio. So to fix this, you always draw a discard tube first, usually a red top, just to pull the air out of the line. Then your light blue tube will fill perfectly. So, the needle is out, the draw is done. But hold on, we are not finished yet. Some of the most critical errors can happen right now, in these moments after the draw. What you do next is everything from making sure that sample is good to go. Two things I really want you to focus on here are inverting the tubes and labeling at the bedside. You have to gently invert tubes with additives. Don't shake them. Shaking causes hemolysis. And labeling has to happen right there at the bedside before you take a single step away from that patient. Let me be crystal clear about this. This is a non-negotiable rule of patient safety. You never ever pre-label your tubes, and you never ever walk away from the patient to label them down the hall. The risk of mixing up samples is just way too high. You label right there, right then, in front of them, every single time. Your job doesn't end when the bandage goes on. The journey of that little tube of blood is still your responsibility. As you can see, some tests are divas. They need special treatment. Some need to be protected from light, some need to be put on ice, some need to be kept warm. Knowing and doing this correctly is just as crucial as the draw itself. So let's zoom out a little bit. Let's look at the most common mistakes that happen before a sample ever gets to the lab for testing, and more importantly, how we can stop them from happening in the first place. Honestly, just screenshot this slide. This is your study guide for what goes wrong and how to prevent it. These are the top reasons labs reject samples. If you can master how to prevent these 4 things, ID mistakes, hemolysis, short fills, and clotting, you will prevent the vast majority of errors. This one's about protecting you. Your safety and the safety of your coworkers is absolutely paramount. You never recap a used needle. The moment it leaves the arm, your hand should automatically go to activate the safety feature. It's not a suggestion. It's a strict OSHA rule, and it's what keeps you safe. Okay, let's bring it all home. Passing your test is about knowing all these steps, but being a great phlebotomist, that's about turning these steps into second nature, into habits you don't even have to think about. This is the whole point, right? Competency isn't about doing one perfect draw while someone is watching you. It's about building such strong habits that every single draw is safe and accurate, even when you're super busy and things are chaotic. It's about being reliably excellent. When you focus on these 4 areas, you go from just knowing the steps to truly understanding the profession. Patient safety becomes automatic. Protecting that sample becomes instinct. Professionalism and consistency are just who you are. This is how you go from being a student to being a master of your craft. So as you get ready for your exam and your new career, I want to leave you with this one question. Which one of these critical behaviors will you focus on turning into an unbreakable habit starting today? Will it be the 3-way ID check? Activating that safety device instantly? Choose one, perfect it, and that will be your first real step toward becoming an amazing phlebotomist.